Hi, I'm Nicole Haas from Therapydia Boulder, and I'm here at Chautauqua to share a few strategies with you for avoiding knee pain. Specifically that knee pain that results from repetitive movements or stress to the structures around the knee and feels like a dull ache that can move around the front of the knee or can sometimes be extremely sharp with a specific movement or activity. This type of knee pain falls under the category of anterior knee pain and is sometimes called patellofemoral pain, patellofemoral syndrome, or referred to as runner's knee. Current research shows a strong correlation between this type of knee pain and weakness of the hip muscles or glutes, especially when combined with the inability to maintain proper alignment of the leg during a functional movement or sport. When the knee collapses inward during squatting, jumping, running, stairs, or any activity where your foot is on the ground and your knee has to bend, it can create irritation of the patella or kneecap and the structure surrounding or attaching to the front of the knee. When the hip muscles aren't strong enough to prevent the knee from knocking inward, or it doesn't fire properly to participate in the movement, then the knee pain is likely to occur over time. The good news is current research also correlates strengthening of the hip while correcting the mechanics with getting rid of this knee pain. That's where we come in as physical therapists to help. Key elements that we use when treating anterior knee pain are proper strengthening of the glute muscles in a functional or sport-related pattern, neuromuscular re-education for the key muscles to assist with proper alignment of the leg during functional activities in sport, basically teaching the muscles what to do and when, and any manual therapy that is necessary to provide proper mobility and tissue healing for irritated structures around the knee or structures preventing proper mechanics. What I'm going to share with you today are my top 3 favorite exercises for strengthening the hips and for teaching those muscles to help control the alignment of your leg during a functional movement or sport. My all-time favorite exercise is clamshells, since there's really no excuse for not getting them done. Most of us are horizontal at least twice a day, once in the morning when we wake up and again when we lie down before heading to sleep, so it should be easy to find time to do them. This exercise is also likely one of the most popular ones my patients get creative with, so if they seem easy when you try them, be suspicious. Often one can accidentally cheat their way through this exercise by using a different muscle group versus focusing on recruiting the glutes, so be sure efforts are made to set up properly and use your hand over the muscle to feel if you're doing it right. In order to do the clamshell exercise properly, you want to lie down on your side with your hips and your knees bent comfortably to approximately 90 degrees. You want to roll your hips slightly forward so that you can encourage use of your hips on the back side or your glutes, and so that you can minimize using the front side of your hips or your hip flexors. You want to slowly start to lift your knee up, ensuring that you only lift it up as high as you can without losing form. If you continue to lift it higher and you start to roll backwards, you're going to feel yourself start to use the front side of your hips. Go ahead and reposition yourself and try to minimize this. You really want to encourage the back side of your hips to work, or your glutes, and you can place your hand on the side of your hips to feel that muscle working. You want to repeat this exercise until you feel fatigue or until you start to compensate and you start to roll backwards and can no longer hold the form. Another favorite exercise of mine is the sidestep with the band around the ankles. What you do is start out with your hands on your hips and a band around your ankles, and you're going to proceed to sidestep one direction repeatedly. Keys to this exercise are keeping your hips level and keeping your toes relatively pointed straight ahead. I often see people compensate by taking extra large steps trying to get more bang for their buck, but what this actually does is turn off the very muscle you're trying to turn on. So you want to try to keep your trunk up tall, keep your hips level, and keep your toes relatively pointed straight ahead. The third exercise I'm going to share with you is the single leg squat. As you stand on one leg and you do the squat, the critical component is that you don't allow your knee to collapse inward towards the other. If you do a squat in this way, all it does is feed the pattern of anterior knee pain that we've been discussing. So as you do a squat, you want to ensure that your knee doesn't collapse inward towards the other and stays over your foot and your ankle. To further increase biasing this towards recruitment of the glutes, you're going to reach your hands and your trunk forward as you extend the lifted leg. If you need help with balance, it's okay to tap that toe down as you complete the squat, and then to stand back up fully. It's critical to stand back up fully to recruit those glutes. To progress this exercise and make it more challenging, you can keep the lifted leg in the air versus tapping it down in the back for balance. You can also stand on unstable surfaces or go progressively lower and lower into the squat. The key component is that you have control of your leg and don't allow it to wobble or don't allow it to knock in towards the other. There's no point in progressing this exercise if you don't have control of that leg, since it only feeds the pattern of anterior knee pain. So there you have it. Those are my top 3 picks for strengthening of the glutes and for getting rid of your anterior knee pain. Strengthening is a process that takes 6 weeks, so don't be anxious if you don't see results immediately. Keep at it, and hopefully your anterior knee pain will disappear. If your anterior knee pain does not disappear, then it would be appropriate to seek help of a physician or to see your physical therapist to further evaluate what stresses and structures might be affecting your knee joint.